Welcome to the instructional video for the use of the EndoSerter-PL delivery instrument, the premier preloaded insertion device for DSAIC. The EndoSerter-PL comes in a sterile transportation case. Using standard sterile procedures, unscrew the case and remove the device. Hold the device with the black deployment wheels and the side printed with EndoSerter-PL facing up. Set irrigation bottle height at lowest setting and ensure all air bubbles are out of the line. Remove the rear white cap and connect the irrigation tubing to the back lure connection. Next, remove the front white cap at the distal end of the anterior beveled sheath. Be sure to hold the media cartridge when removing the front white cap to avoid unscrewing the entire media cartridge. Once the front white cap is removed, initiate irrigation with BSS to flush the storage media from the device. Once the storage media is replaced with BSS, stop irrigation. Do not restart irrigation until the beveled sheath of the EndoSerter-PL is in the anterior chamber. Turn the large blue lure lock on the media cartridge to disconnect the cartridge from the device. Firmly hold the black deployment wheels in position while removing the media cartridge and while inserting the beveled tip of the EndoSerter-PL sheath through the tight 4mm incision. The deployment wheels must be held securely to avoid damage to donor tissue during insertion. Once the beveled tip of the insertion sheath is inserted into the anterior chamber, deepen the anterior chamber using gentle irrigation through the device with bottle height at lowest setting. Continue irrigation as the device is moved across the anterior chamber past the far edge of the stromal bed into the opposing angle. Deploy the allograft by rotating the black deployment wheels forward toward the patient and rotating the EndoSerter-PL 45 degrees to the right as the allograft is exposed. The EndoSerter-PL uncovers the tissue allograft and the sheath will retract towards the incision during deployment. Hold the device in position as the allograft deploys. Rotate the black deployment wheels until the allograft is completely uncovered. When the allograft has completely deployed, hold the black deployment wheels in position and remove the device from the anterior chamber. Discard the EndoSerter-PL device after use. An air bubble is placed to hold the tissue in position. For additional information, refer to the EndoSerter-PL instructions for use.